BEACON is a trial for patients with a history of the BRAF mutation. BRAF mutation historically is a poor prognostic indicator, and you should always test for the BRAF mutation if you think you have a patient that's MSI high attributed to hypermethylation, an older patient per se that may not necessarily have Lynch syndrome. But in the standard MSI stable BRAF mutant patient, it is a poor prognostic indicator. The BEACON study is a 3-arm study of which the results have not been reported as of yet. But the most impressive investigational arm involves 3 drugs: encorafenib, binimetinib, and cetuximab. So including a BRAF inhibitor, MEK, and anti-EGFR therapy as a triplet. In the first 30 patients enrolled in this phase 3 study, they did a quick run-in analysis, and in those patients the response rate was quite high, very favorable at little less than 50% for all patients, but for those patients that had received only 1 prior line of therapy, almost close to 60%. The PFS was close to 8 months, and the overall survival was about 15 to 16 months. But this does suggest that for a BRAF mutant patient population, if you provide more directed therapy in the earlier setting, it may be more beneficial, in fact, and obviously a greater response rate. So I think the phase 3 trial results will come out hopefully in the next couple of years, but this is obviously very encouraging, and that's why it resulted in an early indication for the FDA for this rare patient population.